What's pelvic inflammatory disease? This is inflammation of the pelvic organs, pelvic reproductive organs. This inflammation may be chronic inflammation, and this is due to complications of inflammation like scarring of the pelvic organs, which leads to chronic pelvic pain and difficulty in becoming pregnant of a female patient and other dangerous complications of pregnancy. And there may be abscess formation inside the pelvis, pelvic abscess. This may lead to repeated pelvic abscess formation and adhesion formation. Pelvic inflammatory disease may lead to adhesion formation inside the pelvis between the pelvic organs and the surrounding structures. These pelvic organs which are involved in pelvic inflammatory disease are uterus, fallopian tubes, ovaries, and nexa, and so they all may be adherent with each other, dense adherence. If chronic pelvic inflammatory disease, it may lead to dense adherence and all the complications of pregnancy, infertility. It may become impossible to be pregnant. Other symptoms: lower abdominal pain, frequent lower abdominal pain, repeated lower abdominal pain over a long period of time, long lasting, and dangerous complications. Also, painful intercourse, pain during urination, and irregular menstrual bleeding. There also may be fever with chills. Its treatment is antibiotics. Before that, diagnosis is clinical examination. On clinical examination, there is cervical motion tenderness. On moving the cervix side to side, there will be tenderness of the cervix and the internal pelvic organs, and there may be tenderness, mild to moderate tenderness of the lower abdomen also, and vaginal or swab from the vagina or cervix, swab for culture of the organism, and abdominal ultrasonography, MRI. These may diagnose the pelvic inflammatory disease. How to prevent? Sex with condom. If a patient is complaining of frequent lower abdominal pain and vaginal discharge and dyspareunia or dysuria, painful intercourse or painful urination, burning urination, sex with condoms. And STI testing, regular STI testing, especially women less than 25 years of age who are sexually active and who are not pregnant. And limiting sex partners. Sex within the confines. So, no sex with multiple partners. Never, never, ever. Sex with only one partner, one person, which is allowed. And complete the treatment. Whenever treatment is started with antibiotics, that should be completed with all the prescribed antibiotics and with their dosages. What dosages are advised. So complete this treatment. This is the prevention, and treatment is antibiotics, maybe surgery sometimes for the drainage of abscess, or minimal access surgery if possible with laparoscope or ultrasound guided aspiration. So surgery may be sometimes may be done, may need to be done for abscess, for drainage of abscess.